Today we are going to look at strategies of promoting health and preventing disease in health promotion. So previously we looked at the models and theories of health promotion, and most importantly we looked at how to apply them in our practice of health promotion. So today we are going to look at these strategies of health promotion and preventing disease. So a recap on health promotion. Uh, if we remember our previous sessions, we can appreciate that health promotion aims at improving overall health and well being through various strategies and interventions. And the same health promotion empowers individuals and communities to control their health and make informed decisions, adopt health behaviors, and it focuses on prevention, focuses on health education, and creating supportive environments in which those health behaviors can be performed. So, the strategies that we can use to promote health include healthy eating, physical activity, stress management, immunizations, cancer screening, tobacco cessation, promoting of smoke free laws, healthy food policies, and safe street bike paths. So let's look at each of these. So in healthy eating, as health promoters, we have to encourage individuals and communities to eat a balanced diet that is rich in fruits, vegetables, whole grains, and proteins that are not having a lot of fat around, and these help to prevent chronic diseases like heart attack, diabetes, and obesity. So we need to focus our health promotion on healthy eating because, as you realize from our previous sessions, we have been talking about the fact that uh, we have transitioned from uh, from having problems of infectious diseases to having these chronic diseases as our problems. And heart disease and stroke are one of the greatest diseases that claim the lives of people every year. So we need to focus on how we can prevent them as health promoters, and this is through one of the interventions being healthy eating. So eating foods that are rich in fruits and vegetables, those whole grains like brown rice, and cutting down on fat meat can help us to achieve that healthy eating. And in so doing, we prevent heart disease, diabetes, which can be of a result of obesity, especially the type 2 diabetes. Then strategy number 2 in health promotion, uh, as far as this session is concerned, is physical activity, and this involves encouraging individuals and communities to engage in regular physical activity that can prevent those chronic diseases that have been talked about above. So, apart from preventing chronic diseases, we realize that physical activity enables us to improve mental health and increase overall well being. Being physically fit is always the best thing that you can do to yourself, because mentally you will be better, you will be thinking better. But the most important of all is preventing those chronic diseases like heart disease, which can be prevented through lessening of that fat that could have accumulated in your body. So by doing physical activity, you burn those calories that could lead to accumulation of that fat and clogging of your blood vessels. So you need this physical activity really, and in our subsequent sessions we need to look at how we can we can deal with this physical activity promotion. The World Health Organization encourages an adult to perform physical activity of at least 150 minutes per week, and you don't have to do it just one day. Like, you don't have to do physical activity of 150 minutes just in one day, but you can spread these 150 minutes per week over the days of the week. So uh, you can do 30 minutes per day for 5 days, and that will have made for you those 150 minutes. And this will go a long way to promoting your physical fitness. It will help you to be mentally sound and prevent those chronic diseases like heart attack and diabetes, especially type 2. Then, stress management is a very crucial strategy in promoting health, and it includes techniques like mindfulness, meditation, and relaxation that can improve your mental health and reduce the risk of chronic diseases. We realize that stress inflicts on our physical health, and it leads to some of those chronic diseases developing. It has been cited in uh, in diseases of the heart, of the brain, and even in some cancers actually. So promoting health will require us to put in place techniques that manage stress. And one of one of the most important ones that might not have been mentioned here is having enough sleep. Yeah, because as an adult you need to have at least 7 hours of sleep and good sleep. And strategies of improving your sleep can include making sure that you avoid screens like those of a computer, those of a phone, television. Before you sleep, you should avoid them at least like 2 hours before sleep or 1 hour. Then also eating early enough before sleeping. You shouldn't eat and then sleep. So if you do that, you might improve your sleeping, and it will also help you to manage stress. Then another strategy of preventing disease. So those were the strategies and the strategies of promoting health were healthy eating, physical activity, stress, and stress management. So those strategies of preventing disease include immunizations, and here you want to encourage people to receive recommended vaccinations that can help prevent the spread of infectious diseases like influenza, COVID-19, which is the most recent infectious disease, measles, and HPV. So, in, uh, in a bid to prevent diseases that are infectious, we need to receive this immunization and encourage the individuals that are around us to also receive the same, and taking their infants to be immunized, and also engaging in these routine immunization campaigns. Then another strategy of preventing disease in this case is undertaking cancer screenings, because we realize that when cancer is detected at an early stage, then the prognosis or the outcome will always be better than when it is detected at a later stage. So, encouraging individuals to receive recommended cancer screenings will be helpful in prevention of the adverse effects of cancer. And these screenings could include mammograms, which is used to detect breast cancer, colonoscopies, which is used for colon cancer or the cancer of the bowel, and these help detect cancer early when it is most treatable. So, another strategy of preventing disease is tobacco cessation. encouraging individuals to quit smoking and other tobacco products will reduce the risk of chronic diseases. And these chronic diseases that have been related to tobacco cessation include heart disease, cancer, especially that of the lungs, that of the mouth, that of the throat, and then other lung diseases like emphysema, chronic obstructive pulmonary disease, or what we call COPD, have been related to this tobacco and, and other tobacco products. So, encouraging individuals to quit smoking and use of those products will help in preventing such diseases. So, tobacco control strategies include putting in place tobacco taxes and then advertising restrictions. So, these products need not to be advertised because when you advertise, you increase the curiosity of people who haven't taken uh, those products and they might feel the urge to start smoking. And then smoking free policies, which include making sure that there are restrictions on smoking in public and other places of where people gather. Then other strategies of preventing disease include smoke-free laws, which includes implementing smoke-free laws in public places and workplaces to reduce exposure to second-hand smoke and encourage tobacco cessation. Then healthy food policies it include implementing policies that promote healthy food options in schools, workplaces, and public spaces that help encourage healthy eating habits. So this can always be done by by putting in place uh, those strategies that bring in healthy foods like fruits, vegetables. So you encourage those people who are serving food to the masses to always include in at least those healthy snacks like fruits and vegetables. Yeah. So even in schools, once students feed on that healthy food, they are able to learn that behavior and take it up, and even in future, we'll always be eating those healthy foods. Then in the strategy number 6 here is safe streets and bike paths. So this includes implementing policies that will promote safe streets and bike paths, which encourage people to do physical activity and to reduce risk of injuries. So this involves promoting safety measures, educating on risk reduction, and implementing safety regulations. So in this case, you have to involve uh, other sectors like that of engineering whenever they are putting in place these roads or pavements. They should make sure that they have provisions for people to ride bikes and take part in this physical activity. So this is what we called active transportation in our earlier slide. So we have to encourage people to do this physical activity by putting in place those avenues for them to do the same. But if we have roads that are so risky for them to ride their bicycles, to engage in jogging, then people will stay physically inactive. So the avenues for health promotion include the following, one of them being schools. Schools are always a very crucial avenue for health where we can do our health promotion activities from, and these provide an important setting for this activity of health promotion because they reach a large number of children and adolescents who are at a very critical development stage, and efforts of health promotion will include promoting healthy eating, like we have just talked about it, physical activity, prevention of tobacco, especially in those schools of which have adolescents. So you need to encourage them to prevent tobacco use, alcohol use, drug use, and address their mental health and emotional well-being. Because when you look at adolescents, they are at a stage whereby they could have those mental health issues. They have they sometimes they are engaged in drug use, which could have a toll, which could take a toll on their mental health. They are at a critical stage of sexual development, and maybe that could have an impact on their emotional well-being. So they need to be counseled. They need to be educated on what is taking place, the changes that are taking place around their bodies, and they need to appreciate them. They need to know that those changes are natural, and they shouldn't be they shouldn't feel isolated, but rather embraced, and so that they are not lost to some of those practices of drug use, tobacco use, and alcohol abuse. But above all, they should engage in physical activity, which we said promotes their mental well-being, and they should also make sure that they eat healthily. So schools can also provide health education. It can be incorporated in their curriculum, and then skill building opportunities. Here they are given life skills, and those skills may be to even generate income, because we realized in our previous sessions, for us to improve our self-efficacy or our belief that we can perform a health behavior, we need to be having those life skills. Sometimes we do not believe that we can perform a health behavior because we think we do not have the money to do the same. So if you have those skills that could help you to get that money, then you will have your self-efficacy elevated. And then there are also avenues for policy and environmental changes to support healthy behavior. Then another avenue for health promotion is workplaces. So health promotion programs in the workplace may include initiatives to encourage physical activity, healthy eating, stress management, policies and programs to support tobacco cessation, like making sure that you discourage tobacco smoking at the workplace, alcohol and drug prevention, and mental health support. So, as a health promoter, wherever you go, you do not have to wait to even be given a job of being a health educator or health promoter in your workplace, but wherever you're working, you should be able to promote some of these good health behaviors and discourage those bad health behaviors. So you do that by having information on your fingertips. You need to know the effects of these bad health behaviors, and you need to also know the the good impacts or the benefits of these good health behaviors, so that you can convince people at your workplace to take up these good health behaviors, so as to have better health of themselves. Then another avenue for health promotion can be healthcare facilities, which provide a unique opportunity to promote health and prevent disease among patients and their families. And health promotion initiatives in this case include increasing patient access to preventive care and health education, and interventions to promote health behaviors and manage chronic conditions. So healthcare facilities can also serve as a hub for community-based health promotion initiatives and partnerships. So in healthcare facilities, we shouldn't let people only come to get curative uh, measures and go, but they can also benefit from preventive initiatives because I remember when I was still at undergraduate level, we used in our internship first year we used to engage in educating these people who would come to a village health facility to receive their medication for diabetes and hypertension. So it would be called a diabetes clinic. So whenever they come, before they receive their drugs from the pharmacist, we first take them through first drills of some simple exercises and encourage them to do them even at home, and then educate them on how to eat in a healthy way so that they propagate even this message to the people in their communities. So healthcare facilities are a very crucial avenue for promoting health, and like we have stated here, they also serve as a hub for community-based health promotion initiatives. So you can always gather people around that health facility who have come to receive maybe a treatment, and then you educate them on other uh, activities that can improve their health. And then the other avenue, which is crucial, is the community, which provides the context where people live, work, and play. So, health promotion efforts in the community include initiatives to increase access to healthy food, safe physical activity, and preventive healthcare services, as well as interventions that address those social determinants of health, like poverty, housing, and education, plus employment. So, in this case, when you go to the community to promote health, that's when you better appreciate those social determinants of health. That's when you better appreciate if this community is facing poverty, if they have poor housing uh, systems, if most of them are not educated, and then their employment. So, in this case, you really tailor your health promotion activities to meet the needs of those people. So, health promotion to be done at community level is one of the best things, and the community is one of the best avenues of health promotion. So, when you're implementing health promotion activities, you cannot expect it to be a smooth ride that is devoid of challenges. So, implementation challenges in health promotion activities include, but is not limited to, one, limited resources, competing priorities, cultural and linguistic barriers, and then resistance from target populations, community leaders, and policymakers. So, you realize that health promotion needs a great deal of resources in terms of expertise, equipment, and even the money itself. So, this is not always the case, especially in our settings of sub Saharan Africa. So, we always have that challenge of limited resources, and it makes our work as health promoters a bit hard. But I was once supervised by someone at during my undergraduate research who encouraged me to always find solutions for the challenges that I put across. So I also want to implore you who are listening and who are viewing this slide that as much as we put up these challenges, we should always think on how to find solutions for them. So, for example, if you're looking at a challenge like limited resources, you want to think about a solution of engaging stakeholders who can bring together resources so that we deal with this challenge of limited resources. And these could include non-government organizations, the private sector, who are always having some money that can be devoted to some of these health campaigns, and then we are not going to have that challenge of limited resources. Then challenge number two, which was competing priorities, you find that here, for you to solve such a challenge of competing priorities, you need to make your health promotion a bit of a bigger priority, because most of these people always, especially the policymakers who are going to make sure that your program is allocated money or resources, they always seem to say that there are other priorities, like maybe infrastructure, maybe tourism or other things that they think are generating more income for a country or for a particular area where you're going to implement that health promotion activity. So you need to make them appreciate that health is it's actually the major factor in terms of is the biggest priority, because when you're not healthy, then you can't do anything. Okay, so you make sure that once when you're convincing these people, you have the right statistics of how your preventive action or your promotion activity is going to prevent people from going to spend a lot of money in the hospitals, how it is going to cut on the number of deaths that happen per year, all those statistics will make those policymakers or those people who are supposed to give you these resources to believe that this is more of a priority than others. Then when we talk about culture and linguistic barriers, it can also be solved by engaging the community and also other stakeholders, because we shall realize that from other stakeholders we can get expertise, and this expertise can be informal. These people who are able to translate for us and appreciate the culture of the people that we are going to take our health promotion activities to. So if you're going to implement a health promotion activity in a certain community where you do not know about their culture, then you can engage either stakeholders or their culture leaders who better know their community, and then they can also let you know about their cultural norms, their values, so that you don't go to this community without knowing all that. When you're challenged by the language, they can always translate for you. But in also translation, they need not to distort your message, so that the message that you wanted to deliver is delivered in all wholesomeness. It is not distorted, and it creates problems, or it doesn't create the required impact that you needed it to do. Then resistance from community leaders, the target population, and policymakers also can be solved through engaging and encouraging participation of the community. So when you involve the community from the word go, from the planning, from the implementation, through to the monitoring and evaluation, then your intervention will be accepted, it will be owned, and they will feel they are responsible for the sustainability of this health promotion. But once you do not involve them and you impose your and you impose your intervention onto them, then they will resist, they will feel skeptical, they will doubt your intervention, and it will not be sustainable. So that is how we can solve some of those challenges. So as we go on, we need to not only look at challenges, but also think about how we can solve those challenges. So now we look at a very critical, uh, a very critical tool in health promotion, which is health education. So health education imparts knowledge, skills, attitudes, and values to individuals and communities to promote and maintain good health. It aims to empower individuals and communities to make decisions and take actions that promote healthy behaviors and prevent disease. And it covers a range of topics like nutrition, physical activity, sexual and reproductive health, and many more that will go a long way to promote to improve health in all people. So health education has a very long history dating back in the ancient civilization days where healers and shamans, so shamans are like those people who are believed to mediate between the the visible world, which is here, and then the invisible world, which is believed to be uh, out of this world. And these people provided health advice to their community because the communities had a lot of belief in them, and whatever they said, the community did. So, but in the modern era, health education has begun to emerge as a formal discipline from the early 20th century with development of schools of public health and establishment of government agencies that focus on health promotion and disease prevention. For example, here in Uganda, we have an entire docket that at district level that is always dedicated to health education, and it is always headed by the district health educator who engages in those health promotion activities. So the 1970s and the 1980s saw a significant expansion of health education with the development of health education theories and models, which looked at the creation of these professional organizations that regulate the activities of these health educators and certification programs, and then increasing recognition of the role of health education in public health. So people realize that health education is a very, very critical tool and sector in public health. And currently, health education is recognized as a critical component of public health with focus on evidence based strategies. So, like we have been saying, in public health, we believe in interventions that are evidence based. There should be a backing of information that you have collected, analyzed, and reported so that you can convince people. You do not convince people through rumors. Yeah, there should be evidence that what you're going to promote is really what the community needs. Yeah, you cannot talk about you promoting alcohol cessation in a community, for example, full of Muslims. That might not be evidence based. But maybe if you're going to do that, then you must provide that evidence that really this community, which is a Muslim community, they are drinking alcohol and it is at a very significant level which requires my intervention. So avenues of this health education could also include schools, workplaces, health care settings, the community, and online platforms. So implementing health education can be a stepwise a kind of thing, and it might include these 6 steps, and one of them is needs assessment and program planning, Then step number 2 will be to set goals and objectives for your health education activity. Step number 3 will be to prepare health education material that you're going to use during your health education. Step number 4 will be to choose effective community channels and then engage stakeholders and partners who will be essential in this health education activity. And then the last step will be to implement and evaluate whether your health education program is effective or not. So which we have to look at each of those steps individually. And number 1 was needs assessment and program planning, which is the first step in planning a health education program. And here you gather information about health needs and behaviors of the target population. And this information can be obtained through surveys, especially those snapshot surveys which are called cross-sectional studies. And then you can also utilize focus group discussions where you divide your target population into groups which are homogeneous, so you can put them into groups of men and then women, adults, children, and maybe the elderly, okay? So that you can get those varying views on their healthy needs and behaviors. Then interviews, which could be face-to-face or sometimes online, and also interviews of key informants, so what we call key informant interviews, and other methods which could help you to gather this information about the needs of this target population as far as health is concerned and their behaviors. So this information will be used to design and plan so as to meet the specific needs and preferences of the target audience. So through this needs assessment, you will gain an insight of what the population needs, what it prefers, and then you can tailor your health education towards that. Then number 2 will be setting goals and objectives. And when you're setting your goals and objectives, you should make sure that they are specific, they are measurable, they are achievable, they are relevant, and they are time bound. So that's what we call the SMART approach. So in specific, you want to answer the question of who and what. Then in measurable, you want to answer the question of by how much. And then achievable, how will you achieve those goals? Relevant, why is your goal needed in that community, and then when you plan to achieve your goal. So if I can mention one objective and we see how smart it is, would be for example a goal of to increase the physical activity of employers in organization X in within 2 months, to increase the physical activity of employers in organization X within 2 months. So who and what? If we are looking at that goal of to increase the physical activity of employers in organization X by or within 2 months. So who and what? Is the objective specific? We are looking at the employers of organization X, so it is specific. Is it measurable? By how much? So you have to look at that that objective. By how much? How are you going? By how much? How measurable is it? So here we want to increase the physical activity from say 30 minutes to 50 minutes per day. Okay, so that their physical activity levels can go up so as to prevent those chronic diseases. Then how is it achievable? Yes, of course it is achievable. Within 2 months we can increase that physical activity. Is it relevant? Yes. To prevent those chronic diseases. Is it time bound? Yes. The 2 months the time frame that we have set for ourselves. So that is a smart goal. But if you say uh, to improve health maybe in South Sudan, to improve health in South Sudan. So health in its sense is a very broad topic. It is a very broad thing. So you're not specific. Which health? Are you looking at the mental health? Are you looking at the nutritional health? Are you looking at the social health? So you need to be specific. Even in the mental health, there are other aspects of that mental health. The social health also has aspects. Okay, is it measurable? It might be measurable, but it will require a lot of resources to do that. Achievable, since it is on a wider scale of South Sudan, it might also take you long. So the achievable thing is also questionable in that case. Is it relevant? Yeah, it could be relevant. Time bound. You haven't even put the time frame in such a goal to improve health in South Sudan. So that is not a smart goal, but the other one, which I said first, which was to increase physical activity among employers in organization X within 2 months, was a very smart goal. So when you're setting smart goals in health promotion, in health education, when you're setting goals and objectives, you need to make sure that they are smart, they are specific, they are measurable, they are achievable, they are relevant, and they are time bound. And you do that by answering those questions of the who and what, and by how much, how, why, and when. Then the step number 3 is to prepare health education material, which, and in this case, the health you need to design uh, you need to design your health education material in order to engage and motivate your target audience to adopt healthy behaviors and make informed decisions about health. And these include brochures, videos, social media posts, and interactive websites. So again, here you need to make sure that the health education material is tailored to meet the needs of the people that you're going to educate. You need to make sure that it is appropriate, it is culturally acceptable in this case. Okay, yeah, and you need to make it very interesting so that these people do not switch off, do not just prepare only text. Include things like those videos, plays, which can bring out the message in a funny way, but it is enjoyable and people are able to remember your message. Then choosing effective communication channels is the step number 4 of health education, and it includes using effective communication channels that can reach the target audiences, and we realize that different communication channels may be appropriate for different audiences. For example, the younger audiences will prefer social media, while those people who are old not might not like that information of social media, but will benefit from print media like newspapers. So consideration of those communication channels will include audience characteristics, message content, and available resources. So if you're going to educate people on the proper hand washing technique, then make sure that at least Yet you might be using that effective, you might be choosing, when you're choosing your communication channel to deliver such a message of hand washing, it has to be in video form. Okay, so if it is in video form and you are going to demonstrate it, you cannot use print media because you have to use media which is visual. You have to use televisions, you have to use billboards so that this message comes out clearly. Step number 5 is to engage the stakeholders and partners, and these play an important role in planning, implementing of health education programs. So they provide valuable insights into the needs and preferences of the target audience, and most importantly, contribute resources and expertise to the program. So examples of these stakeholders could include community organizations, healthcare providers, opinion leaders, culture leaders, government agencies, schools. All these are very crucial in health education. Then the last step is to implement and evaluate your health education program, which where we realize that health education program should be implemented with consistency to the planned program, and it should be continuously monitored and evaluated to determine their effectiveness. You shouldn't wait for this program to end before you monitor. You should monitor to see where you need improvements, to see where you're working, and to also gather information that will be used to convince all the stakeholders that your intervention worked, and it can also be a foundation for future interventions. So in health education, we need communication and teaching skills, and here we realize that communication theory provides the framework for understanding how people will process and respond to your health information that you will be providing through this health education. And principles of this effective communication include being clear, being simple, and being empathetic, placing yourself in the person's shoes. You need to be empathetic whenever you're delivering your health education. So effective communication strategies for health education will include clear and simple language, using visual aids so that you can trigger that emotional feeling in the person, and then multimedia and using storytelling and personal narratives. So in the end, you want to achieve health literacy, which refers to an individual's ability to understand and use health information to make informed decisions about their health. So health educators, while doing this, should be able to design and deliver effective health education programs, which includes making a lesson plan, group facilitation, and classroom management. So whenever you're delivering your health education talk, you need to make sure that you're, you are doing it as if you are handling a class, okay, somehow, but an ideal class, not these classes where you do not gain anything. So you need to plan for it, set the objectives for your health education talk, and let them be smart, like we have said. Then during the process of health education, make sure that you engage your audience in group discussions, and in those group discussions you should be the facilitator, not the one who contributes everything, okay? And in so doing, you're going to trigger their critical thinking and problem solving skills, so that those ideas that you want to propagate out there as far as health education is concerned should also emanate from them. They should come from them. The people should be able to realize what they need to do about their lives, okay? So they should be able to bring up ideas so that so that they can also take full control of the health behavior that they are going to put in place to achieve better health. And then classroom management, you need to make sure that you manage your discussion or health education activity very well by by managing your discussion very well. We mean that those people who want to run the show, who want to contribute everything, should be managed in a way that limits somehow their time, and then encourage those people who are not contributing to also contribute, because you want to gain from each and every person as much as possible in that classroom that you have set up, which is the health education audience. So they should also be able, the health educator should also be able to evaluate learning outcomes by, of course, asking questions here and there, by using some few quizzes. And this should always be interactive and adjust teaching methods in case the ones that you had are not working well. Then, in motivation, interviewing, and behavior change, health educators use open questions so as to gain as much information as possible, reflective listening, and empathy to help individuals overcome barriers to behavior change. So, health educators should be familiar with the motivational interviewing and behavior change counseling techniques to effectively support behavior change among the target audiences. So, a critical point here that we have to make mention of is empathy, which is very different from sympathy. In sympathy, you're taking part in someone's feelings, but in empathy, you appreciate their perspective. Okay, so if you want to, you're delivering health education uh, about about hand washing with soap, and someone is telling you about their barriers, especially poverty, they cannot afford this soap and they are even crying. You shouldn't join them to cry, but you should realize, you should appreciate their perspective. You should put yourself in their shoes and appreciate that it will be very hard for this person to buy this soap and dedicate it for hand washing after visiting a toilet. So how about they use an alternative to soap, which is a bit cheap, like ash, which has been proven to be an alternative for soap. It is not better, but it is a viable alternative for soap, and it will it will be it will come in handy when we are talking about when we are doing hand washing. So by you placing yourself in someone's shoes and not taking part in their emotions, then you will better appreciate their situation and develop means to help them. So that is how empathy will be applied here. Then another critical thing in health education and promotion is advocacy. So advocacy for health promotion and disease prevention is critical to create policies and systems that support healthy behaviors and lifestyles. So in advocacy, you are promoting the interests of the health sector. You make people appreciate how important the health sector or your health promotion activity is. So in this case, policy and advocacy refer to influencing decision making and promoting change at individual, at community, and systemic levels. So it involves building coalitions and engaging stakeholders, involves influencing public opinion and policymakers. So the advocacy strategies here we look at grassroots organizing, media advocacy, lobbying, and coalition building. So health educators should understand the strengths and weaknesses of different advocacy settings, strategies, and choose the most appropriate strategies for their target audience and policy goals. So we need to appreciate uh, which which advocacy strategy is going to help us. Okay, so if we are looking at maybe influencing policy, then we need to make sure that we do media advocacy, where you make sure that you use your media to promote that the message that you want to put out there. You use it very well so that it puts that message out there to the community and even to the policy makers. Okay, then so advocacy strategies, like we said, include building coalitions and engaging the stakeholders. So here you work with diverse stakeholders, including the community organizations, healthcare providers, policymakers, and advocacy groups to build partnerships and also take advantage of the resources from these people so as to effect policy change. Then another advocacy strategy is influencing public opinion and policymakers. Here you use strategies to influence public opinion and policymakers, including, like we had said, media campaigns, social media, grassroots organizing, and direct lobbying. So lobbying is more of influencing that opinion, especially of those policymakers and the public. So that is also a very good advocacy strategy to promote the interest of the health sector and your health education activity. Then another critical thing in health promotion is evaluation and monitoring, and it's important to ensure that the program that you have put in place to promote health is effective, efficient, and achieving the intended goals. So evaluation and monitoring help to identify the areas that need improvement, to assess the impact of intervention, and provide evidence for decision making and resource allocation. So if you realize that uh, a component of your health promotion program is not working, then you you highlight it and make sure that if there is need for more resources, then they are allocated. So effective evaluation and monitoring can also help build trust and accountability among stakeholders, including program funders, participants, and partners. So the information that you gather from your evaluation and monitoring, you have to report it to all the stakeholders, the program funders, and if you do so, if they see uh, that the intervention is working, the resources are being used correctly from your information or your data that you have collected during your monitoring, then you are able to create that sense of trust. So the types of monitoring and evaluation could include process evaluation, which focuses on how well a program is being implemented. So this is done during during the course of the program implementation, and it includes whether it is being implemented according to plan and how the participants are engaging with the program. How are they responding to the program? Are they appreciating its usefulness? Are they owning it? Is it going to be sustainable? Are the people pro the program or against it? Okay. Then outcome evaluation focuses on short and long term outcomes of the program. And in long term, we look at the changes in knowledge, the behavior, and health status, which could form the overall impact of this health education program. Then considerations for monitoring and evaluation include the fact that it should be aligned with the goals and objectives that were set before the program even started. So this ensures that evaluation measures are important and relevant. And then we need adequate resources to do this evaluation and monitoring, which includes funding, staff to do the evaluation and monitoring, and expertise, because not everyone has that expertise of M&E. So number 3 of the consideration is using appropriate methods to do this evaluation and monitoring. So as to be to be in line with the program goals and objectives and the context. But one of the most important consideration is the fact that it should be done in an ethical way that promotes privacy, confidentiality, and informed consent. So if you are going to collect your information for this monitoring and evaluation, then you need to make sure that you collect it in a way that ensures privacy of the participants. You should consider confidentiality without putting their identifiers like the names or and the location of these people that are giving you information, and then they should be informed about the benefits and risks of taking part in your monitoring and evaluation activity. So health system integration in health promotion activities. Health promotion should be integrated into healthcare systems to enhance accessibility and quality of preventive services, and it involves incorporating the health promotion activities during routine healthcare visits and screenings. So this will take the collaboration between healthcare providers and public health practitioners so as to achieve optimal health outcomes. Like I said earlier, this is being done and it needs to be improved and sustained, because I say that I want to part in promoting health in these people who had come to receive their medication for diabetes and hypertension. So such collaborations between us, the public health practitioners, and those healthcare providers who are going to give the medication will go a long way to promote this integration of health promotion activities and this healthcare provision. So in the end, we shall achieve optimal health outcomes. Social determinants of health in health promotion will aid in addressing inequities, and social determinants of health impact health outcomes and create those health disparities. We realize that those people who are highly educated are more likely to make better decisions about their health. Those who have more income are more likely to access better health care than those who do not. So those are the social determinants of health. And health promotion strategies must address those determinants to promote equity and improve health outcomes. So strategies include addressing income inequality, access to education, safe housing, and social support, and collaborative efforts between community organizations, policymakers are very crucial in addressing these social determinants of health. So the policymakers are very, very important in this case. Putting in place strategies like 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 the health insurance policy, so that these people who are disadvantaged in terms of their income access health and do not suffer from those catastrophic expenditures whenever they are sick. Accessing good housing or safe housing, education should also be a bit affordable so that they gain knowledge that will enable them to take on those better and recommended health behaviors. So it is very crucial in health education to address those social determinants of health so as to make sure that health is for all and is enjoyed by each and every person regardless of their social status. So this brings us to the end of today's session where we have learned uh, about health promotion strategies and the avenues of health promotion, the challenges that we can face. Then we also looked at health education, its avenues, and the steps of implementing health education activities. And then we also looked at monitoring and evaluation in these health education activities. And that was it for today. Thank you so much for your time, and I wish you a very good day.